was some good applause. Okay, I'm gonna try to make some sense of our healthcare, and I only have a few minutes to do it. It's kind of like trying to make sense of a Rube Goldberg contraption. So, the shortest distance from point A to point B is a line, right? So, our healthcare system is like from point A to point B. You know, you go to the Mars first, and then the line comes back to B. That's how complicated it is. And I'm sure it's complicated for all you all. It's ridiculously complicated for me. So I think there are some important questions that we all have to kind of ask ourselves. And this is the framework of this whole talk. So really, how much are you willing to spend? Why are costs rising so much? Where's the largest area of spending? So we'll focus most of our time on these questions. And ask yourself this question, because all of our healthcare costs are rising. And I mean, this is changing so rapidly. Just last week, we learned that we're going to all be experiencing some double-digit growth in our premiums, and it's going to be harsh for everybody. With regard to where we're at with healthcare, so as of August, we've seen the largest increase in health insurance costs since 1984. And our healthcare cost for a family is expected to go to $18,000, which is a rise of 3.4%, which is much faster than wage growth. And that one thing I'm really going to focus on are prescription drugs, and there's a bit of confusion around that. So in the US, they're very expensive, and that's because we're the ones that develop a lot of these. But we'll also talk about generics and just how much generics we use in the US as well. Okay, regarding our health, because I want to make it clear that healthcare doesn't exactly equate to better health. This slide shows that the life expectancy of the US is about 79 years old, 78.8. We have a pretty high infant mortality rate relative to other countries. And a huge proportion of our population, 65 years and older, has 2 or more chronic conditions. So that can't be negated when you're trying to understand the cost of healthcare. We do generally have we have worse health in the United States, and much of that drives our healthcare costs. Regarding spending, we spend about $9,000 per year, and our life expectancy is about 79. Switzerland spends $6,300. Their life expectancy is 83 years old. But something that might be new to you is that mortality rates for cancer are actually among the lowest in the US. And we also spend the most in cancer treatment as well. So there's this quote that I wanted to mention. Time and again, we see evidence that the amount of money we spend on healthcare in this country is not gaining us comparable health benefits. And that's the president of the Commonwealth Fund, Dr. David Blumenthal. We have to look at the root cause of this disconnect and invest our healthcare dollars in ways that will allow us to live longer while enjoying better health. So all the investment in healthcare doesn't always equate to better health. So one of the answers why healthcare costs are so high, we have a huge amount of administrative costs. About a quarter of our healthcare is associated with administrative costs. In a lot of other countries, they don't have all of the private insurance that we have, so that is one of the big reasons. Drug prices. In most countries, governments actually negotiate drug prices. But when Congress created Medicare Part D, it denied Medicare the right to negotiate drug prices. This is not the case for the VA or Medicaid, which can negotiate, and that's why they have the lowest drug prices. And usage. The US uses 3 times as many mammograms, 2.5 times the number of MRIs, and 31% more C-sections when compared to other developed countries. We've been having some insurance companies that have started to totally come off the market. And just recently, Aetna decided to totally pull out of the Obamacare exchanges, and one of the reason is that they have quite a few additional patients, and they tend to be a lot sicker. So their risk pool of patients, in order to kind of balance it out, to make it profitable for them, so they don't lose so much money, is that they have to have lots of healthy people that are insured as well. Well, that's not exactly happening. So sick people, they claim that sick people are kind of draining them by utilizing their health insurance. And when insurance is mandatory, people are faced with a decision to either purchase or to pay a penalty. A lot of younger folks are actually paying that penalty. So there's a large influx of sick people who are insured now, and the insurance companies say that they just can't do it anymore. So to compare, I wanted to show you some comparisons between the way we spend for our cancer care and exactly the outcomes that we get for that. So like I said, healthcare is not the main driver of health and longevity. You know, I'm an epidemiologist, so I think a lot about genes, diet and exercise, accidents, violence, all that stuff those are the major contributors. We spend about 18% of our GDP on healthcare. Now, you know, sometimes that's worth it, and a lot of times it's not, but this is where it's worth it, and it has to do with our cancer care. For example, Slovakia, they spend about $39 per person on cancer care. They have an average of 5.5 years of life expectancy after your cancer diagnosis. So Sweden spends a bit more than that, $134, and from the time an average patient is diagnosed to their death is about 10 years. The U.S. spends the most on cancer care, $207, but we have the best cancer survival rates out of any country. So to get to price and utilization, so what I learned is that price and not use, that's the force behind increasing medical cost. And in the early 2000s, price and utilization contributed to the growth in healthcare costs. But since then, as you can see, utilization, that yellow line, has kind of gone down, while price is kind of the same. And that has a lot to do with us not being able to negotiate costs with our prescription drugs and other factors like this. We do utilize, so this is where the puzzle becomes a little trickier, because I just told you it's not utilization, but it's more complicated than that. Some pieces it is because of utilization. So when you compare us to Canada, we use like double the number of MRIs. So they have an average of 53 MRIs per 1,000 people. We have about 107. With regard to our bypass surgery, it is about $75,000 in the US, and in the Netherlands it's about $15,000. That's the same bypass surgery. It's just dramatically higher in the US. And we also, with regard to, it doesn't have to do with our annual physician visits. So that's the part of utilization. We only go about 4 times a year. And in other countries, on average, they go about 6.5 times a year. So where exactly are we spending a majority of our healthcare dollars? So the nation's healthcare bill was about $2.9 trillion, and the majority of that was in hospital care. And a huge chunk of it as well is actually in physicians and clinics, that orange piece on the left. Just to talk a little bit about more comparisons between countries. So we just learned that bypass surgery in the U.S. is $75,000. An appendectomy in the U.S. is $13,000. Now, relative to Australia, it's $5,000, or in the Netherlands, it's $5,000 as well. Our MRIs are also more expensive, $1,100 versus $461 in the Netherlands. CT scans are more expensive. So A lot of this has to do with just our system. Like I said, our administrative costs really make our healthcare system a lot higher, and we're quite a bit unhealthier too. So now if we were to shift to the prices of our non-generic drugs, so it's like kind of ridiculous when you compare between the US and other countries. For example, we have Celebrex in the US generally costs $330, but in Canada it's about $51. And here in the US you can spend $430 for 100 tablets of 10 milligram Prozac. Or you can get the generic, which is fluoxetine, which is an absolutely identical molecule. And you can spend $55 for the same 100 pills. So the question is, why do we care so much about how much our drugs are rising, or whether it's gone up by 5 or 50% in the past quarter? One of the real problems is that no doctor should be prescribing it, and no insurer ought to be reimbursing it. No patient ought to be taking it if there's a generic drug and the cost is a quarter of the non-generic drug. So there's much more blame to go around than just blaming the pharmaceutical industry, because our generics are just so much less expensive. So today, nearly 8 in 10 prescriptions that are filled in the US are for generic drugs. Regarding Canada's model, they have a kind of an interesting model. They have the patented Medicine Prices Review Board that determines a maximum price for all drugs. We actually don't have that. But generic drugs in the US are among the cheapest in the world. And the reason why we have such expensive non-generic drugs are mainly due to the prevalence of disease and the intensity of treatment. It's only moderately due to price increases. We just use a lot of drugs in this country. That's kind of the point. So doctors routinely prescribe drugs like Nexium, and insurers routinely pay for them. But Americans pay more for drugs when they first come out and less as they get older, while the rest of the world pays less in the beginning and more later. So we had a few answers in the beginning. I wasn't able to cover everything. I was just trying to wrap my head around all this. So does more spending correlate to better care? Sometimes regarding cancer care, but definitely not always. The ACA, who are the winners and losers? I think the winners are high utilizers and insurance companies. Premiums and deductibles are up for everyone. Those in the middle income who don't have any subsidies are actually the losers in this system. The largest area of spending we found out was hospital care, and trying to understand insurance costs and drug price spikes. A lot of that has to do with just profit. I know we all heard of the EpiPen, the increase in the EpiPen. That's just a profit-driven thing. And so why is it so expensive? We're generally less healthy. We treat much more aggressively, and prices aren't controlled. So that's my talk.